So thank you so much everyone for joining.
Nangihit pa.
If you want to have a toilet break, so you can right now. We will start at exactly 12:10. Okay, so good afternoon, everyone. We are still waiting for more participants. We will start at exactly 12:10. Once again, thank you so much for joining today's eTALK. We have a lot. I can see a lot of students from Silliman University. May I also acknowledge Ma'am Maria Cecilia Henove. Thank you so much, Ma'am, for joining our eTALK and for the support for the library's activity. Thank you so much. I can see familiar faces now. Okay, so 12:08. 12:08. Okay. Currently, we have 35 participants. So I hope more will join. We also have our fellow librarians joining. Hello, Ma'am Elvie. Our acting university librarian, Ma'am Dinoy. Ma'am Salares. Hello, Ma'am Angela. We have also here our technical team, Sir Elmar, Ma'am Relene, Ma'am Clarice. Thank you so much for your help. So it's exactly 12:09. Good noon, Ma'am Salares. 12:09. So we will start at 12:10. Okay, so we will ready our
Ikaw din, be? Mute my audio.
Okay, so it's already 12:10. Hello and good afternoon, everyone. Welcome And thank you so much for joining today's eTALK entitled Managing Infodemics, Information Dissemination, and the Fight Against COVID-19. So before we start, please allow me to read to you the house rules for today's eTALK. Okay, so these are the rules and regulations that should be observed by the participants during the whole activity or the whole session. So first, number one, please turn off your microphone and camera if not needed. Second, your name in Zoom shall appear coded by your honorific name dash affiliation. So for example, my name is Charmaine and I am affiliated to Silliman University. So my name is Charmaine dash SU. So I will give you time to edit your name right now. So just follow the format, your honorific name, then dash affiliation. Okay, so number three, you can change your name while I'm reading the rest of the house rules. So number three, this is for all our FB participants. By the way, we will be live in our FB group, FB page, Silliman University Library. So you may share, tag, or mention your friends to join this FB live stream, but please refrain from posting unnecessary comments in the comment section. Okay, so our fourth rule is that this is for Zoom participants. Questions and clarifications will be entertained after the talk. By then, you may turn on your camera and microphone, or you may use the chat box. You can see it at the bottom of your Zoom. So the moderator will cue if you are already recognized. For our FB participants, you may key in your questions and clarifications in the comment section, but it will be entertained after the eTalk. So please stay until the end of our eTalk. And after that, make sure to fill out correctly the evaluation form to secure your certificate of participation. So that's it for our house rules for today. We may now proceed to the program proper of our eTalk. So may I request everyone to please bow down our heads and feel the presence of our Lord for our invocation to be led to us by our Bliss alumna, batch 2018, Miss Elisha May Manalo.
We pray for blessings, we pray for peace, comfort for family, protection while we sleep. We pray for healing, for prosperity. We pray for your mighty hand to ease our suffering. All the while you hear each spoken need. Yet love is way too much to give us lesser things. 'Cause what if your blessings come through raindrops? What if your healing comes through tears? What if 1,000 sleepless nights are what it takes to know your need? What if trials of this life are your mercies in disguise? We pray for wisdom, your voice to hear. We cry in anger when we cannot feel you near. We doubt your goodness, we doubt your love. As as if every promise from your word is not enough. And all the while you hear each desperate plea, among the fleet had faith to believe. 'Cause what if your blessings come through raindrops? What if your healing comes through tears? What if 1,000 sleepless nights are what it takes to know you're near? What if trials of this life are your mercies in disguise? When friends betray us, when darkness seems to win me now, the pain reminds this heart that this is not our home. It's not our home. 'Cause what if your blessings come through raindrops? What if your healing comes through tears? What if 1,000 sleepless nights are what it takes to know you're near? What if my greatest disappointments or the aching of this life is the revealing of a greater thirst this world can't satisfy? What if trials of this life, the rain, the storms, the hardest nights, are your mercies in disguise?
Aisha Manalo. Now, to formally welcome everyone, please help me welcome here on our virtual stage our very active and very supportive acting university librarian. To give her welcome remarks, let us welcome Assistant Professor Rosalina G. Dinoy.
Okay, so we apologize. Hello. We apologize for the technical difficulties. We lost the connection. Hello. Okay, we apologize once again for the technical issue.
We have 55 participants right now. Okay, so is Ma'am Dinoy admitted or around now? Is she ready? Okay. Okay, so we have admitted 56. Okay, so Ma'am Dinoy is ready now. So once again, let me introduce our acting university librarian, Assistant Professor Rosalina G. Dinoy, for her welcome remarks.
Ladies and gentlemen, good afternoon. It is my privilege to welcome you in today's eTALK entitled Managing Infodemic, Information Dissemination in the Fight Against COVID-19. Let me quote a statement from Mike Ryan, an epidemiologist at World Health Organization. He said, Be fast, have no regrets. If you need to be right before you move, you will never win. Welcome to another learning moment. Today, as we listen to our speaker, we need to share whatever knowledge and insights we gain on how to cope with the pandemic and keep in us those essential preventive measures to fight against COVID-19. We must play our part in helping to prevent the spread of the coronavirus in our local community. We need to understand what's happening and how we can protect ourselves, our loved ones, and everyone that surrounds us. I sincerely hope that this discussion in this webinar and the information we shared can be applied effectively in our workplace and wherever we are. To all the students, faculty, librarians, administrators, and those joining in social media, welcome and good afternoon.
Okay, so thank you so much, Ma'am Rose, for that warm welcome. Once again, on behalf of the Silliman University Library System, we welcome all the participants right now. Thank you so much for joining today's eTALK. So may I acknowledge again the presence of our speaker, Dr. Walden Ursos, our acting university librarian, Ma'am Rose, and also Dr. Maria Cecilia Genove. Thank you so much for joining us today. To all our participants and to our supportive fellow librarians, thank you once again for joining us for today's eTALK. So I know that you are all excited to listen to our speaker right now. So, but before that, let us have a short icebreaker first, okay? So this time, you will get, our participants will get the chance to win a 100 peso load GCash from GCash, okay? That is sponsored by our digital librarian, okay? So 3 participants will win 100 peso load and 2 lucky winners will get a premium account for Grammarly, okay? So in Grammarly, you can have assistance with your grammar. Okay, so I think everyone's excited right now. The mechanics is very easy. It is the questions will be all about facts about COVID-19. So the rule is that the first one to comment in the chat box the correct answer will get the prize. Okay, so our technical team are now ready to check who will comment the first correct answer. So I hope everyone's ready now. Let's go to the first question. The first question is this one: when and where was the first outbreak of COVID-19 in China? This is for 100 peso GCash worth of loan. Okay, we have Marvin Florendo. Okay, wow, kaabtik. Marvin, ka-quick, be ready na dagawin mo na imong answer. So let me read sa chat. 2019, Marvin Florendo. Marvin Florendo, Wuhan, China. Oh, missing. When and where? Kanus-a o asa? Kailan at saan? Okay? 29. Oh, sa 2019, I need the month. Month sa 2019 ug ang place. Okay. Okay, we have our winner. Okay, kinsa man ni Wuhan. The correct answer is Wuhan, China. Napag na siya kulang nga kuan or date pero we'll accept this one. Wuhan, China, November 2019. The first one to answer is Wuhan, China, November 2019. Si Florendo? Okay, Florendo again. Wuhan. Okay, so si Florendo. Okay, we have Mr. No, nada. Kinsa man. Okay, the winner is Carla Baliola. Thank you so much. Congratulations. You have won 100 peso GCash load. Okay, so Miss Carla, please email us at askthelibrary@su.edu.ph. Email us your name, your course, and your cell phone GCash number. Okay, so we will send to you within the day your prize for this question. Okay, so congratulations once again, Miss Carla Balyola. Wala pa yung mga violent reactions. Okay, so let's proceed to the next question. This is also another worth 100 pesos GCash load. Okay, so question number 2. Congrats once again, Miss Carla. List 3 common symptoms of COVID-19. Okay, kinsa kaha ang makauna? Who will answer first? 3 common symptoms of COVID-19. Okay, fever, sore throat, and cough from Ma'am Sarah Salares. Okay, congratulations. Kaabtik sa kamot mo type. Congratulations. So Ma'am Sar, the same procedure to claim your prize. Please email us at ask. Anyways, kabalo nakasakwa. Okay, Ma'am Salares is our cataloging librarian head. Okay, so next, our third question. Another question worth 100 peso load, GCash. Okay. So list 5 approved vaccines in the Philippines. Nabakunahan na ba ang tanan? Kinsa may wala pa din mahadlok injection. Okay, list 5 approved. Okay, someone shot AstraZeneca. We need 5. There are actually a lot of vaccines. Yes, Joshua. Okay, we have a winner, Joshua. Okay, si Sir Joshua, Sinovac. He answered Sinovac, AstraZeneca, Johnson, Moderna, Pfizer. We have also, mas nauna si Ma'am Jill. Si Jill.
It should be correct spelling. Sharp, correct spelling.
Moderna, Pfizer, Sinovac, Astra.
It should be correct spelling.
Should be correct spelling. Alam mo, gawatch ni Dr. Su. Okay, correct spelling. Which one? Sa atong technical team, kinsay unang naka-comment and correct spelling. Sinovac, Pfizer. That is why you need the Grammarly premium account to check your spelling, no? So swerte kayo ang makadaog sa atong premium account Grammarly. So our technical team right now is checking for the. Okay, so we have Joshua. Okay na ba, Doc? Joshua. So see Joshua, we have our winner.
Spelling is okay.
Yes, okay, so Sir Joshua, the same procedure to claim your prize. Just email us at askthelibrary@su.edu.ph, your name, your course, and your GCash number. Okay, so our we will proceed, or we will continue the okay, so we will proceed with the last question, and this is worth the premium account for Grammarly. So this question, we will have 2 winners. Okay, so I hope everyone's ready. Ready your gadgets now. Our last question for a premium account, Grammarly premium account. Please send a picture of your vaccination card. Okay, send a picture of your vaccination card. Run. Run sa wallet. A picture of your vaccination card. It's much nicer if you hold your vaccination card with selfie with your vaccination card. So we're still waiting. Vaccination card. I hope if not all, most of us have got their Can you all send pictures sa Zoom? Okay, I am informed that we cannot send a picture of our vaccination card. So to solve this, can you please send a picture of your vaccination card to us, the library at su.edu.ph. Okay, so the first one to send their picture to our email account, so will be declared as the winner. Okay, so we will announce the winner after after the eTALK, the talk of our speaker. Okay, so we apologize for that. So once again, you can send the picture, the selfie picture of your vaccination card to us, the library at su.edu.ph. So I hope a lot will participate. So we will get 2 lucky winners to get 1 premium account for Grammarly. So once again, congratulations to our winners. And I hope you enjoyed our short icebreaker. Okay, so I think everyone is ready now. Huh? Nawala na ba ang mga stress? Okay, so let us proceed to the main event of this eTalk. May I call on here on our virtual stage to introduce our guest speaker for this afternoon, for this noon. Please help me welcome our nursing librarian, Miss Clarice Eliseo Omiting.
Good afternoon, everyone. Our guest speaker for today is an alumnus of Silliman University, graduated in the year 1984 with the degree of Bachelor of Science in Biology, cum laude. He earned his Doctor of Medicine at West Visayas State University in Iloilo City in the year 1988. He is currently the medical consultant of the Department of Internal Medicine at Silliman University Medical Center. He is also the chairman of Silliman University COVID-19 Crisis Management Group from 2019 and up to now. And he is also a member of Silliman University Library Committee. Please help me virtually welcome the Dean of the College of Medicine, Dr. Walden R. Ursos.
Good noon, everyone. Thank you for your willing participation and to listen to what I'm going to share to you today. First of all, I'd like to thank the invitation extended to me by our acting librarian of the university, Assistant Professor Rosalina Dinoy, through the coordination of our very own assigned librarian at Silliman University Medical School, Mrs. Charmaine Luba Galapate, who is our host this morning. And I just realized she has this talent, so I will give her more hosting work in the future. Okay, so thank you for being with us. I know and I hope you've eaten your lunch. And I told Mom Dina I cannot eat my lunch if I'm still at work. You know, I'm still going to talk, so I cannot afford myself to be somnolent during my talk. You know. So thank you once again this opportunity. Actually, this is my second series of talk about COVID-19 pandemic and its consequences. And at first, I had a lecture on COVID-19 vaccine hesitancy, which I believe the whole university have listened to that. And now we'll have this opportunity of talking about a new observation or a new consequence of the pandemic, which is the COVID-19 infodemic. So can I share my slide now? Asa galing ko mo share ani char? Here. Okay. So share screen. So I'm waiting for my IT to help me. Okay. So please enable the host Nisha. Please enable your sharing so that I can show my slides. The host disable participant screen sharing. So can you allow me to share my slide, please?
Co-host na ka daw.
Okay. Okay. So okay. So can you see my slide? I will try to magnify this, and I hope it will move with you because sometimes it depends on your signal. So my slide wouldn't move. Hindi siya move. Mubalin ko rin, di ba?
Doc, we still cannot see the slide, Doc.
Yeah, but I have shared already.
Okay na, Doc. We have seen.
But the question is, will my slide move? Hello.
Yes, Doc. Slide share. Just click that one, Doc. Kanang naay. Or F5.
Okay, can you see my slide now?
Clear
Huh?
na. Yes, Doc. We can see your slide, Doc.
Okay, so I will hide you. Okay, so good noon, everyone. Our topic is stop na pong sharing. PowerPoint. I-close ko na rin. Sa PowerPoint. Ikaw i-close mo.
Hello, Doc. Okay. Okay,
Can you
so
hear me?
yes, Doc. Loud and clear, Doc.
Okay, so allow me now to share with you my slide. There's something wrong with the signal. The signal is weak.
Philippine problem. It's okay, Doc.
Wag kulang na mo pakusog. Ni kailangan mo pakusog ng siliman ng signal.
Adrian.
Okay, so can you see my slide now? Ayun na lang.
Yes, Doc. Yes, Doc. Okay.
Sige. So I will not magnify this so that the signal will be able to keep with it. Okay, so our topic this noon is about managing infodemic, information dissemination in the fight now against COVID-19. Now, okay, to start my lecture, the main objective of this lecture, number one, is I am not here to, I don't have the intention to correct any misconception, misinformation, or disinformation about COVID-19 pandemic and its related health issues that we are facing right now. Because I consider this as everyone's social responsibility for every individual to deal with, okay? I'm here to just convey and share to you the awareness and knowledge about the phenomenon of what we call infodemic. So amidst this COVID-19 pandemic, there has been a hidden epidemic parallel to our current pandemic, which we call an epidemic of information that stand out as a digital infodemic of misconception, misinformation, and disinformation about the current global health crisis. So I am here to share with you both practical and scientific ways of dealing and managing the COVID-19 infodemic. But I had no intention of correcting whatever issues we are facing now, because it's your own personal responsibility to deal with it and able to apply what I'm going to share with you today. So first of all, let me define and share with you the origin of the word infodemic. The word infodemic is a blend of information, the term information and epidemic that typically refers to a rapid and far-reaching spread of both accurate and inaccurate information about a topic or about something such as a disease, no, that poses a health threat to the general population. And because of the combination of information about an epidemic, so there will be there will be both accurate and inaccurate information. And as facts appear and being shared to us, rumors and mixed and dispersed fears, no, to all readers would happen. And it would be difficult to us to learn and delineate which one is essentially true information about the given issue or about the pandemic. Okay. So the term infodemic was coined as a blend of information and epidemic in 2003 by a journalist and a political analyst, Mr. David Rothkopf, who is a correspondent in the Washington Post column. When the world's attention was on less terrifying health crisis before, now it has seen new usage now of the term during this time of the COVID-19 pandemic. Too much information, including false or misleading information in the digital world, no? And also, of course, in the physical environment during the onset of the outbreak. So we asked that in our icebreaker, when was COVID-19 pandemic started and where? Since then, no, there are too much information, okay, and it causes confusion and it become a risk-taking behaviors that can actually harm the health of the individual. It also leads to mistrust in health authorities, the government, and undermines the public health response against stopping the pandemic. So it becomes a concern, no? Not just for every individual, but it becomes a concern of the whole world, no? Especially World Health Organization, who is mandated and tasked to safeguard the health of all people of the world. So an infodemic can intensify or lengthen a disease outbreak when people are unsure about what they need to do to protect their own health and the health of their loved ones or the people around them. With growing digitalization and expansion of through social media and the internet use, information can spread more rapidly at this present time. No? Information can spread fast because of the digital and social media of the internet use. So this can help. No, it should have a positive result or impact because it can help to spread information quickly, but also it can also amplify harmful messages or wrong information also quickly. No? So it becomes a two-edged sword. No? It has both a positive effect and of course it also produced a harmful effect. So alongside the COVID-19 pandemic, we've experienced a parallel infodemic of disinformation with nutty ideas racing around the globe, no, through information shared through Twitter, Facebook, even TikTok and WhatsApp, and other social media platforms. But experts suspect that the real problem is a range of subtle practices which, in shaping human contacts and the way we make decisions for our health, turn to social media into an engine of untruths. So whatever information you read or listen through the social media, okay, you should be able to determine which one is true or not. And that will influence our decision making if on how we are going to protect ourselves against this pandemic. So our digital environments need re-engineering if our collective brain is to find a way back toward promoting the truth. And this has been shared to us by Buchanan et al. No? When they shared to us insights on how to manage infodemic, no? In the midst of this global pandemic. So according to Mr. Tedros and Nahum Ghebreyesus, the World Health Organization Director General, during a security conference in Munich, Germany in 2020, he said, we're not just fighting a pandemic, we are fighting also an infodemic. Infodemic of fake news, misinformation, and conspiracy theories have become prevalent in the age of social media and have skyrocketed since the beginning of the COVID-19 pandemic. This situation is extremely concerning because it undermines trust now in health institutions like our Department of Health, our LGUs, and the intervention programs that we are trying to implement against the pandemic. On June 29, 2020, World Health Organization formally began the conversation on global effects and the management of infodemic, which is first infodemiology conference that convened international experts from diverse scientific and political backgrounds. And through that conference, they have acknowledged that there is an immediate and widespread sharing of medical and other scientific information outside of expert circles. So there are information who are not based on evidence as discovered and as studied by experts. There are also information that are fake and hearsay. Before it has been thoroughly vetted, they are already spread. And that can be dangerous, especially in a pandemic like this. So pandemic is rapidly evolving. It's a rapidly evolving setting. No? Until now, we're still fighting this pandemic for almost 2 years now, in which researchers and medical professionals are constantly learning and contributing to the dynamic adjustments and in making government policy and formulating government policy. So we have IATF, we have advisories and guidelines that we need to follow. Even DOLE and CHED and DOH are working together. PRC for a board exam and even the Supreme Court about the bar exams. No? We are all affected by this pandemic. So we need to have a concerted effort to fight this pandemic. But if there are controversies and issues that goes along with this pandemic, then it can break the trust and, of course, break the cooperation of every responsible Filipino in this country. Okay? So compounding this information is the fact that governments rarely make policy decisions solely on the basis of empirical medical evidence. There should, in our country like the Philippines, political interest will always have a role to play. It has a key role in making decisions, the politics of it. And two are frequent odds to each other. Medical evidence and political interest always clash with each other. So we have to balance economy and safety of our people. So even though we implement a lot of health restrictions, no, we are right now under GCQ with intense restriction, but still we have increasing cases in front of us. No? So government wants to be perceived as being in control and too quick to provide full reassurances. So, according to the Lancet, no, on infectious diseases published in August 2020, no, government and the people have to work together to fight this pandemic. And we have to correct misconception and misinformation about the crisis. Okay. So misinformation confuses by diluting the pool of legitimate information. Conspiracy theories work because they provide the comfort of an explanation in times of uncertainty and anxiety. Their messaging revolves around core emotions and values and even hijacks the mental cues or mental status that we use to decide whether the source is legitimate and trustworthy. The most pervasive and damaging of conspiracy theories incorporate grains of truth, no? But who benefits from this misinformation? No? So probably these theories and misinformation have some truth in it because they have also their own basis. But the question is who benefits from this misinformation? And the best example of this is the anti-vaccination campaign, which is notable, no, at the moment. So that's why we have this so-called vaccination hesitancy among some individuals. The UNICEF made a situational analysis and shows that vaccine hesitancy against COVID-19 vaccine is quickly transposed onto all vaccines and is excruciatingly difficult to reverse such notion. And none of this would work well for the acceptance of vaccination against COVID-19. So vaccine hesitancy becomes a problem, okay, because even among children, we don't have a vaccine yet. No? And that's why UNICEF is trying to do research study, because sooner or later it will again now involve also not just adults or elderly, but it will now involve the children. And there are already cases reported of COVID-19 infection among children. So the state of affairs cannot continue. No? The policy making of the government cannot continue where the very existence of COVID pandemic is being denied. Some even do not believe that there is a pandemic. They said that this pandemic is just a hoax. Whether it's a hoax or not, it's there in front of you. And all of us has its own testimony to share because many of us already became a victim of this pandemic and many of our relatives and loved ones died and many of our health workers already died because of this pandemic. So we cannot deny that there is a pandemic. Okay? So immediate coordinated action is needed from the global, political, corporate, and the scientific community to maintain the integrity and credibility of the professional expertise. And we have to rebuild that public trust so that we will be able to combat this pandemic and we will win against pandemic. Because if we cannot win against this pandemic and this virus will win against us, this COVID-19 infection will become endemic to the world, or not just to our country, but other countries. And can you imagine if COVID-19 become an endemic infection affecting, that's going to be a nightmare. Okay. So the coronavirus COVID-19 disease is the first pandemic in history in which technology and social media are being used as a massive scale to keep people safe, informed, productive, and connected to each other and can have a concerted effort to combat the disease. And at the same time, however, this same technology and social media, that we rely on to keep us connected and informed, it can also amplify the infodemic that continues to undermine the global response and jeopardizes measures to control the pandemic. And this is what the World Health Organization is trying to educate all of us. Hence, coronavirus disease or COVID-19 pandemic has emerged as a significant and global public health crisis. And the rising number of cases and fatalities has also affected both the economy or the economies of countries, employment among our working group, and has really changed the policies of every country just to mitigate this pandemic. So as billions are being isolated at their homes to contain the infection, we are given quarantine advisories. The uncertainty gives rise to mass hysteria and anxiety. So amidst this situation, there has been a hidden epidemic of information that makes COVID-19 stand out as a digital infodemic from earlier outbreaks. Okay, and we have to recognize this and address this, because if this will continue, we will not defeat COVID-19 in the past. So added to this, now is the tsunami of misinformation, rumors and conspiracy theories circulating every day. So with increased digitalization, media penetration has increased with a more significant number of people aiding in the information pollution. So this is another term, information pollution, tsunami of misinformation. Now, repeated and detailed content about the virus and other related information, geographical statistics, and multiple sources of information can all lead to chronic stress and confusion at this time of crisis. And that will further aggravate our anxiety and uncertainty during this time. So WHO further says that misinformation and disinformation can be harmful to people's physical and mental health, increase stigmatization, threaten precious health gains, and lead to poor observance of public health measures. And one of that is your vaccine hesitancy, reducing their effectiveness and injuring countries, not endangering countries' ability to stop the pandemic. So misinformation can cost lives. Without the appropriate trust and correct information, diagnostic tests will go unused. We don't trust the diagnostic test, so we cannot diagnose the case early in time to prevent complications. Immunization campaigns or campaigns to promote effective vaccines will not meet their targets. So we keep on saying that we want to target and obtain herd immunity by the end of this year, by December, and be able to vaccine or immunize 80% of the population. So where are we now? This is already September. We are still 15, more than 15% of the target. So we cannot meet the target. I don't think so we can meet the target by December. And the virus will continue to thrive from then on. So how many more years we have to wait? When will COVID-19 be finished and mitigated? Okay. So we need to have insights and strategies. So dear students and part of the Silliman community and the general public, okay, we have to have correct insights and effective strategies. Okay, the possible cause of infodemic, and studies have shown, they have observed that one possible cause of the infodemic is low health literacy. And we have more free time, using our gadgets, Facebook, YouTube, and all this social media. But again, despite of this, we have the low health literacy index. So in a population with a low health literacy rate, increased availability of free time as a result of COVID-19 lockdowns and quarantines may have contributed to the infodemic. We have more time to share information because we are locked down. But the question is, are we sharing the correct information? Health literacy has been defined as the individual's capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions and to address or solve a health-related problem like COVID-19. So, according to the American Journal of Tropical Medicine, we have to correct ourselves. Let us not be illiterate about our health. Because after all, we have our own rights to health. And so we are responsible of our own health. So we have to develop this so-called health literacy to preserve our own lives and the lives of our loved ones. Reports show that a rumor has 3 times greater chance to be shared on social media than a verified or validated story. And lack of health literacy in a population will have the capability to amplify such problems. So the general recommendation is to look for alerts, including the length of the post, extent of engagement, where it contains advertisements, and its relevance to the reader. The only information one should share is information that has been investigated and validated and understood by the reader. So if you don't understand completely the information that you are reading or hearing, please do not share it because it will create more misinformation because you shared it wrong. Okay. So in this context, the UN Secretary General launched the United Nations Communication Response Initiative to combat the spread of misinformation and disinformation as early as April of last year. This is a joint statement, okay, of WHO, United Nations, the UNICEF, the UNDP, UNESCO, UNAIDS, ITU, UN Global Pulse, and the IFRC. These are all international organizations that are related to health, education, and campaign. So managing the COVID-19 infodemic means promoting healthy behaviors and mitigating the harm from misinformation and disinformation. So at the World Health Assembly in May 2020, WHO member state passed a resolution, WH is 70.1, on the COVID-19 response. The resolution recognizes that managing the infodemic is a critical part of controlling the COVID-19 pandemic. It calls all member states to provide reliable COVID-19 content, take measures to counter mis and disinformation, and create and leverage digital technologies across the response. The resolution also calls on international organizations to address mis and disinformation in the digital world, work to prevent harmful cyber activities undermining the health response, and support the provision of science-based data to the public. So take note, we should provide science-based data to the public for them to read and be informed. And this is the website that I want to share to you. You can look at this in the internet. Call for action, managing the infodemic. This is a global movement initiative to promote access to health information and mitigate the harm, health disinformation among online and offline communities. The United Nations system and civil society organization are using their collective expertise and knowledge to respond to this infodemic. At the same time, as the pandemic continues to create uncertainty and anxiety among us, there is an urgent need for stronger action to manage the infodemic and for a coordinated approach among states, multilateral organizations, civil society, and including the academic institutions and all other actors or stakeholders who have a clear role and responsibility in combating mis- and disinformation about COVID-19 and its related concerns and programs. So the UN call on member states to develop and implement action plans to manage the infodemic by promoting the timely dissemination of accurate information based on science and evidence to all communities and in particular to high-risk groups of individuals, and preventing the spread and combating again mis- and disinformation while respecting the freedom of expression. We respect every expression of religion, knowledge, or information, but we have to base it on what is true based on evidence. So the United Nations further call on all other stakeholders, including the media and social media platforms, to which mis- and disinformation are disseminated. Researchers and technologists who can design and build effective strategies and tools to respond to the infodemic. Civil society leaders and influencers has to collaborate with the United Nations, with member states, and with each other, no? We in Asia Pacific, and to further strengthen their action to disseminate accurate information and prevent the spread of mis- and disinformation. So this is the slogan of the World Health Organization. No? Health and well-being is a right of every individual. So we have to create an information ecosystem that is true and correct so that we can address the health crisis that we are facing now. But because of the presence of infodemic, we need to respond to this another infodemic crisis through science, research, okay, and technology platforms, including social media platforms. And we need the civil society to take charge, including journalism and media, no, in collaboration with other both private and government agencies or institutions. So with this call, how do we then manage the infodemic? Infodemic management is the systematic use of risk and evidence-based analysis and approaches to manage the infodemic and reduce its impact on the health behaviors during health emergencies. Infodemic management aims to enable good health practices through 4 types of activities. First, listening to the community's concerns and questions. Second, promoting an understanding of risk and health experts' advice. Building resilience and proper judgment towards misinformation. And lastly, engaging and empowering communities to take a positive action. So another slogan, okay, from WHO saying the right information at the right time in the right format. So while it is not possible to really completely eliminate now this infodemic, it is possible to manage and minimize the impact of this infodemic. Infodemic management aims to ensure people have access to factual information in a timely manner that is easily understood, so they may rapidly adapt their own behavior to protect their own health and the health of others during this pandemic. So, infodemic management must be backed up by science, rely on risk-based, evidence-based initiatives that empower communities to take action. So we just don't rely on our own government. We just don't rely on DOH. We need to empower ourselves, empower communities to take action. So let's help each other. Okay? Make use of the best practices, including sharing of experiences, especially those who became victims of the COVID-19 infection, and continuous learning among our students and professionals so that we can share the correct information, the right behavior, and the right attitude towards towards combating this pandemic. So this is just a caricature on how people receive and process information and how they act on this information, which is really varied. No? So from one point of source of information shared to three people, okay? So this person didn't send a rumor to the group chat. So out of the three, two shared same information, but one did not. Because he found out that the information is just a rumor or misinformation or no evidence. Who he stopped sharing that, no, through social media. But the two continued, shared it to another three other people. So there's an exponential sharing of information. But again, there were four people who validated the information and stopped sharing it. But the rest continued to share. So if people would be more aware that the information that they are receiving doesn't have to be shared to others because it's wrong or it's a misinformation, then we can minimize the spread of infodemics. So at the end, only few would be left. So understanding how information originates, evolves, and spreads through different platforms and channels is the key to managing the infodemic. So let us be aware and let us have that social responsibility to screen the information that we receive, okay, and process it scientifically. And if we found it to be not a valid information, I would not help sharing it, then stop sharing it. Okay. So we only share what is true and correct. So that is the process of receiving and processing information. And so there's another online post shared by WHO, okay, COVID-19 online post. So when you receive an information, you can have three attitudes towards it, okay, or behavior. Number one, you can choose to ignore it. So why should I read it? No, it's too long. I don't know the author. The author seems weird. I cannot even read their names. Contains advertisement, and for me, it's not relevant to me. So you can choose to ignore it. But if you want to entertain such information, you can be skeptical about it. So ask the question also, why? So look at whether it's a Photoshop information, or it's really believable, or it looks unbelievable, and even weird in context. No? And sometimes it might be just a joke. So be skeptical. But if you found out that the information is valid and can be trusted, through your own evaluation, and you're confident that the source of the information is credible, okay, and it is research-based, it is evidence-based, then you can accept the information and you can share the information to others. But if you choose to ignore or you're skeptical and you're not convinced about the validity of the information, then do not share it, okay? But if you're skeptical, you can investigate it or not to investigate it. It's up to you. No? But if you are an educated person and inclined to learn some more, then you might as well investigate it to really know what is true. No? So investigate the claims, evaluate the information, evaluate the source, comment on the post. No? These are probably just editorials or posts of certain authors, and compare it with other sources. So there is such thing as we call the critical appraisal of the journal or the article or whatever we read about. So if you found it helpful to share, then you share it. And that's one practical way of preventing the spread of infodemic. In the scientific way, again, WHO shared to us, infodemic management intervention aims to influence health behavior. So it's really about our own beliefs and behavior. No? So number one, the scientific approach of infodemic interventions. Number one, listen. Again, still listen to concerns. Then number two, translate science and communicate the risk of the health crisis. And then promote resilience to misinformation. So you should be critical. Your resilience means you should be critical and you should know how to filter what is right and wrong. And fourth, you engage and empower the community. You start from yourself, you engage your own family, you engage your colleagues, you engage your own institution and the whole community to combat infodemic. Okay, so allow me to run through to you. Now I'm almost done so that we can have also open forum in the end. Let me run through to you the scientific approach proposed by WHO on how to intervene in infodemic. So number one is listen to the concerns. So what is our concern now? Now, quantifying information through social listening. WHO uses a digital listening approach which analyzes and quantifies information associated with COVID-19. It enables health information professionals to respond earlier to the infodemic, to fill information voices and inoculate resistance against misinformation with a real-time analysis of narratives or statements from the general public. Okay, so that's why this is where the role of the library system for every university or of all schools here in the country. Build world-leading information infrastructure to serve countries to understand the right attitude of the general public in addressing and mitigating the health crisis that we are facing right now. Moving from surveys to data pools, analytics, real-time research, flexible and locally adaptive of generating valid information which we can share. Number two, how will we translate science and communicate the risk, the health risk that we are facing right now? Medical and public mask, like how do you wear your mask? How do you wear your shield? What is the proper way of wearing your mask? So do you really believe in wearing the mask or the shield? And there's even a discussion in Senate and in the Congress just whether we wear a mask or a shield. So how to wear a mask safely? How to wear the mask properly? What kind of mask we will use? Medical mask or just a cloth? How to break the chains of transmission? So there are what we call levels of prevention, that we cannot be infected with the virus. And so how do you protect yourself against this virus? Okay, there are 7 steps to prevent the spread of the virus. And you can read that in the DOH website. That has been followed by Silliman University, being a member of the COVID crisis management group. We follow all these safety protocols. We implement this in our university. We made advisories about how can we protect our own campus, okay, our own house or households, and how can we protect our workplace? Because the transmission of this infection is already in the community. Also can also be transmitted in the workplace. And now that we are going to have this face-to-face academic classes, that's again another challenge. That's why CHED established guidelines to protect our students, faculty, and staff. So translate science and communicate the risk that we have to take. But again, it's our own personal decision whether we are willing to take the risk. Next is promote resilience to misinformation. So how will resilient How resilient are we? When you say resilience, be resistant to misinformation. We don't tolerate it. We don't condone it. We resist it and do not share it. Okay? So it depends on your level of knowledge and how to develop this resilience, against misinformation. Third is the second way to promote resilience and misinformation is you have to know what we call the public health research agenda. There are ongoing research, no? So we, Silliman University, are so active in research. We have contributed a lot of researches and published a lot of researches. So this is about time, no? That we can also do research about infodemic so that we can minimize the spread of infodemic. So WHO has prescribed what we call public health research agenda. So kung ang USAID o ang this organization promoting research have their own agenda, no? CHED, DEX, DOH, you have all research agenda. No? Now we have a new set of research agenda in managing infodemics. So this is one field that the students can look into, okay, when you do your research studies. And lastly, how do we engage and empower communities? WHO works with communities to protect health during epidemics through new initiatives and projects. So the three key words. Now, number one is co-development. We have to develop a practical guidance or guidelines about COVID-19 education, preparedness, and response to support faith-based organizations and faith communities. No? So, co-development. Second is collaborating. We need to collaborate, especially with the young people. Now, intelligent, talented young people to design creative, engaging, and relevant communication strategies around reducing the transmission of COVID-19 infection. And we are challenging every student association that we have in every academic unit of the university. And third is facilitating. Now, facilitating means, since we cannot do face-to-face right now, you can do a virtual dialogue series together with leaders and representatives from different walks of lives or the world of workers. Because workers are the being really affected, the working group, really the one affected with the pandemic. So how can we facilitate virtual dialogue? So right now, we're doing this eTALK. This is one virtual way of talking and discussing the existing problems or issues that we are facing and try to find ways to mitigate and intervene this problem. So working together to support public health. Remember, you cannot say that you're not part of the public. We always say no man is an island. When you say public, we are part of the population. No, of Dumaguete, we are part of the population of Negros Oriental, and of course, part of the population of the Philippines. So how can we work together to support public health? Collective efforts and initiatives to ensure consistent, systematic, predictable support to partners involved in public health and humanitarian, and develop responses, develop strategies to stop the pandemic. Now the virus is just laughing to all of us. It's up to this virus when he will stop or not. So in summary, to summarize all that I've been sharing with you, to manage the infodemic, we need an evidence-based framework, like that of an epidemiologist. As what Ma'am Rose Dinoy shared when she had her introduction, that an epidemiologist of WHO said that we don't have to wait until everything is being discovered. This is a dynamic process. So infodemic management needs to be mainstream into public health preparedness and develop response plans, because flattening the infodemic curve will help us to flatten the COVID-19 pandemic curve. No? So karon di pagalit naka-flatten sa pandemic curve, COVID-19, na po tayo laing infodemic curve that we need to flatten. So preparedness and monitoring is measure and monitor the impact of an infodemic during health emergencies, detect and understand the spread and impact of the infodemic, then intervene, respond, and deploy interventions that protect and mitigate the infodemic and its harmful effects. And finally, strengthen resilience of individuals and communities to the infodemic. And how we do that, we need to evaluate our knowledge and how we intervene this infodemic. Okay. So there is a banner, no, that WHO made. This was shared by the Federation of Library Associations, no, and institutions. No? So it was a confederation of library association and institution that shared this. No? How to spot fake news. Okay, so we can make this as our reminder. No, reminder, or what we call código. Consider the source. Click away from the story to investigate the site, its mission, and its contact information. Then check the author. Do a quick search on the author. Are they credible enough? Are they real, really? Are they really authors or just commentators? Check the date. Reposting old news stories doesn't mean they're relevant to the current issues or events. Now, I was a victim of this. No, nibasa ko og mga news shared in the Facebook Messenger that it turned out ay na idugay nang ni kayo. Ito pa rin tuigaw pag gani pandemic, no? So sometimes they're already not relevant to the present situation. Then check your biases. Every individual has its own biases. Consider if your own beliefs could also affect your judgment, and ultimately will also affect your own health. No? Because even I'm lecturing epidemiology in the medical school, even religion can cause health crisis. So check your biases or beliefs. We respect every individual's beliefs. We respect every religion in this world. We respect every decision of every individual. But just see to it that it will not boomerang to you and will affect your own health and will cost your own lives. And I've had experience and witnessed, lives lost because of biases. Then read beyond. If you read headlines, sometimes headlines can be outrageous in an effort to get clicks and likes. So really understand the whole story, read the whole story, understand the whole story, and you go beyond whether these are worthwhile to be believed. Supporting sources, click on those links. That's why we need references, sources. So sa ato pang research pa, literature sources, literature support, review of literature. So determine if the info given is actually supports the story or the news. And the worst thing, if it is just a joke. If it is too outlandish, it might be satire. Well, it's a joke. Natawa na ta, malipay ta sila nagkatawa. But actually, is it worth sharing? Well, kung joke, gusto na po mo pakatawag lang tao, okay lang yun to make us happy. But research the site and the author to be sure. And if it's a joke, then take it as a joke. Do not make it as a formal information about a fact. Okay. So, and finally, ask the experts. And it struck me. One of the experts that they listed is ask a librarian or consult a fact-checking site. And that's why I appreciate this activity initiated by our library system of Silliman University. Because now I realize that librarians have a role to play in sharing the correct information and leading or pointing to the right source to read correct information. Especially now, we don't really just rely on books anymore. That's why I was asking Charmaine, Char, na pa ba yung libros library? Kasi puro na lang ta online, ani, no? So, puro e-books na lang ta. And our own anatomage, no, wala na may cadaver, our own anatomage, which is a virtual cadaver, has its own e-book already. And the students are going to avail of that. No? And they're going to use it in their learning. And so librarians are considered as part of the experts to guide our students, faculty, and the rest of the university, you know, to point to the right source and the right information. So to close, I have two more slides. And let's look at this in a wider perspective. There are 6 policy implications to consider if we want to minimize infodemic. Number 1, intervention and messages must be based on science and evidence and must reach the citizens and enabling them to make informed decisions on how to protect themselves and their communities in a health emergency like now. Second, knowledge should be translated into actionable behavior. So there should be a behavioral change, okay, presented in ways that are understood by and accessible. Of course, that change should be based on knowledge. Fourth policy is to strengthen the analysis and amplification of information. Impact strategic partnerships should be formed across all sectors, including but not limited to social media and technology sectors, including the academy and the civil society. Fifth, health authorities should ensure that these actions are informed by reliable information that helps them understand circulating narratives or discourse and changes the flow of information, question, and safety in responding to COVID-19. Infodemic should be further developed to support preparedness and response and to inform risk mitigation and be enhanced 6 as to data science and social research for that matter. And that's where the role of the academy would come in. So that ends my lecture, and I hope I have satisfied the purpose of our topic. And these are all I'm an expert in mitigating infodemic. I'm just here as an epidemiologist trying to share with you my readings and which I believe. I also as my lecture, I also screen my readings, which I believe can impart knowledge to the same. So, ladies and gentlemen, thank you for listening. And I will say we are all in this together. So let's break waters on the tsunami of infodemic, debunking rumors, engaging messages, and amplifying information. So through making breakwaters, we can mitigate and minimize infodemic if we cannot totally eradicate. So thank you very much and good noon to everyone.
Okay, so thank you so much, Dr. Walden, for that very informative discussion on managing infodemics. It was also personally, it was also heartbreaking to hear there is this aside from the fast kanang spread of the virus. Also, there is also misinformation that is also that is also spreading fastly. So I think the effort, I sympathize on the part of the frontliners as well, because they are doing all the efforts. They are the ones who are on the front line, but because of the misinformation with regards to COVID-19, the efforts of all the people, the government, and the frontliners are at stake. So thank you so much once again, Dr. Ursos, for that wonderful and very insightful discussion. So I think we are now ready for the question and our answer portion. So we will now entertain questions from our participants. We have comment here. Thank you so much, Dr. Ursos from Abigail. Thank you as well, Abigail, for joining today's eTALK. So I'm encouraging everyone. Yes. So I'm encouraging everyone to please message or comment down your questions for Dr. Ursos about anything about the pandemic or the COVID-19 or the infodemic. So we're still waiting. Okay, so do we have questions? Also, I'm also encouraging, if you have your questions, you can just message or type the word me, and we will allow you to speak, to turn on your microphone and your camera if you want us to see you. No? Kasi we miss everyone. So it's nice to see face to face instead of kaning kuan lang. Okay, my question is too long from Mary Chris, so you can turn on your mic. And if you are confident sa imong background, you can turn on your camera as well. Okay? So are you ready, Miss Mary Chris?
Yes, I am.
Okay, hello, Miss Mary Chris. So you can now ask your question.
Hello. Wait, I'm gonna get out my background because it's so my question is there's this problem with the data and statistics of COVID cases, especially in India, and it's an infodemic. It's a problem of numbers, and it's not a problem of theories and sciences. It's a problem where even auxiliary science cannot back it up or support that kind of problem. So the problem is scientists has been delivered to India, and they were paid to get like authentic data and authentic rates of COVID cases. But then it turns out to be that the scientists that were paid, their data were not compatible, and they actually falsified the data. And it's sad because in the data they shared is like the actual data is 5 times bigger the data they have shared, something like that. So what should we do with this falsified data? What should we do with it?
Then do not believe it. Just don't believe it. Junk it. But first is have the proof of your statement that they are falsified and they're fake. And they're hard to study the data. So number one, who sent them? And if I'm the one sending them, I'm going to hang their heads because I'm the one paying them, right? So who sent them? WHO. So, and I think the government of India also being a stakeholder, because they allowed these scientists to come into their country and study their data. So they have every right also to question these scientists Because, you know, if you give a fake picture of the country, that will also affect the credibility of the country, no? So, kasi gi-bloat nila ang ilang result just to show nga dagag yung kayo mga matay sa India or what, no? And, you know, knowing India was one of the highest population in the world, no? And when Delta strain struck them, no, you can see people just mga tumbaras dalan, no? They just died spontaneously. And, you know, that is more shocking to the media and to the whole world seeing that in the news, no? But if the scientists are set there to study and make a valid analysis, no, we call it analytics, valid epidemiological analysis, then they should report and publish their data correctly. So number one, no, prove or klaruha kung fake ba yun or they are making a falsified result. No? Because, you know, being a scientist, mo kag falsified result, you know the implication nga gifundingan ka. And second, government of India should also be knowledgeable in how to detect if their data is wrong or not. So there should be what? Naman po Department of Health ng India, di ba? Just like our DOH. So what has the DOH of India has to say also as far as their data? Okay, they are and make a valid conclusion and recommendation. Okay, then it seems falsified. Then isumbong na ni Tulfo. Isumbong your social responsibility if you think that these data are really falsified. So why do you have to waste your time reading and believing them? Junk them, throw it to the trash can. There are other articles and journals that you can read, no? So that's what you call critical appraisal. So you have to know how to critically appraise the article or the report or the news. And I think information is being shared in the social media. So that's where your social responsibility will come in. And if you think that it's fake or it's falsified, do not share it.
The library personnel.
Wala ko'y labot, ala. Kamulit tubag, ala.
Anyways, to answer that question, only the admin knows, no? We are still waiting for the announcement or any instructions regarding the opening of the library or for the face-to-face. But anyways, we still serve our students and faculty through our virtual library. So you can email us through askthelibrary@su.edu.ph. So if you want to borrow books, you can just message us anytime. Okay, so we have, Doc, we have another question from Dr. Maria Cecilia Henove.
Yes, ma'am. Go ahead, ma'am.
Yeah. Hello, Doc Henove. Her question is, verifying information and fact-checking take time, but
Yes.
journalists or the media need to do it. But if the information comes from a credible source like
the World Health Organization, but conflicts with other sources, I think this is where the infodemic happens. How do we filter such information? Cases are rising, casualties are rising.
Yeah, that's true, Bam. I believe that the pace of flattening the curve for the COVID pandemic cannot really equate also our pace of screening or filtering information. So that's where the trust of the public has to be gained by the government and from health and private institutions. So, like even in our own experience here in Silliman University. So, DOH required us to create a COVID-19 crisis management group so that we can address both the protection and safety of all our faculty and staff that really engage with the academic responsibilities that we have in teaching our students. And we're really greatly affected. Instead of doing the face-to-face, almost the online distant learning na tayo. So, the crisis management group adopted the guidelines of the local and provincial IATF. No? So we recognize the government, the Department of Health, and the LGU as the source of guidance and the implementation of guidelines that we need also to follow. So that's why we want to filter which one is more effective. And despite of that, there are still people who do not want to cooperate, or who do not want to subject to the guidelines, because some will say that it's a violation of their rights or their religion. No? So filtering is really difficult, no? And that will take time. And for us to really act fast, we just have to implement this guidance, whether you accept it or not, or you cooperate or not, because we did a survey, gamay raman pong proportion itong dili mo cooperate, dili mo tuo. No? But the majority is following our guidelines. So that's why our role is, yeah, media can help instill trust in our government. So kung di ka mo tuo sa atong gobyerno, you like it or not, sila may gabuot sa atong risk classification. Sila mga ITF may mo declare kung GCQ ta, MGCQ ta, ECQ ta. And when these risk classification are being implemented, there are restrictions that we need to follow. So kung dili ta mo follow sa restriction, then we cannot really stop the spread of this virus. No, we cannot stop the pandemic. So we always start from ourselves. No, the solution to this pandemic is start from ourselves and share the right information and correct the wrong information that others are following. They will hopefully, all of us will be acting in concert to achieve a common goal, and that is flattening the curve of the COVID-19. And bisag kining kaning attaining our herd immunity, it's really a great task. So kung na pwede mo cooperate on vaccination, di kita ka-achieve na itong herd immunity. And there will be consequences on that. So that's why we have this kind of activity. It's one way of health promotion and education, which are what we call this, we can implement in our own area of responsibility. If there will be different guidelines, sometimes it's not consistent. That's why what we do in our own COVID-19 management group, we make the necessary judgment, no, what is good for our own community. So, katong pag-declare of GCQ with intense restrictions, no, actually our guidelines did not change. We still follow the modified GCQ until now. So, like the guidelines set by the government, they may have basis of that, but for us, we still have our own reasons why we need to follow such guidelines. So, example of this is, ang cross ka from other provinces, you also need an acceptance letter from the government, from the, like going to Dumaguete from the mayor's office, and a negative RT-PCR test. But here in the campus, we still implement the 10-day quarantine, no? When you come from other provinces. Kaya gitangtang na siya sa sa tourism o sa LGU, but we believe that the incubation period of the virus will always be there once you are exposed to a probable case, especially with the Delta strain right now. So, well, sometimes manigurista taba, maniguro, but after, in the long run, this is for the good of everybody. So sometimes guidelines are differs, no, and interpretation and implementation differs, but the common goal is there, no. So which one will, walang gitawag to customization, no, because these are not dogmas. These are mandates, but that's not dogmas in a way, no. So like ang katong Ched, gusto some other parts of the country wants vaccinators, but based on our assessment, adequate naman atong vaccinators there is sa Dumaguete and Negros. What we need are more vaccines, not vaccinators. So like that, so depende sa situation. And one factor that will affect us also is that we are an archipelago. What is happening may not be happening in karon. Best example, ang board exam sa medicine, cancel ang board exam sa NCR because ECQ other completely to NCR. But the board exam centers in Cebu, Cagayan, and Davao, and in Zamboanga, ipadayon na. So that's why our graduates from SAMS are taking the board exam in Cebu, and some are in Davao. But katong ni register sa Manila, wala rin tawag sa take because the cancel ang board exam for NCR. But because they're on ECQ. So, yan, so sometimes differ ang situation, differ po ang implementation of guidelines. But there's a common goal, which is to mitigate the health crisis. So, I hope that answer your concern, ma'am. And of course, you have more experiences in social media and in journalism also.
Okay, so thank you so much, Doc.
So,
Yes, so
yeah.
media can help instill trust in our government and our officials. Guidelines are not uniformly implemented too, thus causing confusion. So media just echoes or mouths what our officials says. Okay, so that's the comment from Dr. Hinove. Okay, so thank you, Doc Hinove, for that wonderful question. And then, okay, so as much as we would like to have more questions coming up, but we don't have enough time. So Doc, for the end of our eTALK for today, do you have any message on those people or groups or organizations that spread false information about COVID-19 or the pandemic? Do you have any words for them, Doc?
Well, my only appeal to these people who just really want to create a confusion in making fake information is that just stop it. So we should know how to spot fake news or information, and those who are making fake news and information, please stop it. You're not helping. Okay, but again, it's always our own social responsibility to judge and to develop that behavioral change. So we should have a common goal. So we hope that we can also have a unified and orchestrated approach and strategies. But it's really difficult to deal with individuals who have different views and opinions. No? And that's why, even here in Siliman, dagang bright Siliman, sa dito makasinabot, kay daghang tang bright diri. Okay na itong sa bright, the rest abotol, kay katulad bright tuwan. But kung bright na tanan, alisod yun, dito makasinabot. So that's what you call two sides of the coin. No? Yeah, thank you for this privilege and opportunity, and thank you for listening. And I hope I have shared my readings also with you, and you can read this actually in the internet. Just go to those websites, and I have said I'm not here to correct misconception. I'm just here to share what is the best practical and scientific way of combating this infodemic. So thank you.
So much, Doc, once again. So we don't have enough time, so we will now give our certificate to our speaker. So let me read the citation first. Wow. The citation of the certificate. Okay. So Silliman University Library System Certificate of Recognition is presented to Dr. Walden R. Ursos in grateful recognition and sincere appreciation as resource speaker during the eTALK with the topic Managing Infodemic, Information Dissemination in the Fight Against COVID-19, held on September 17, 2021 via interactive Facebook Live and Zoom. Signed by Assistant Professor Rosalina G. Dinoy and Dr. Earl Jude Paul L. Cleope, our VTAE Academic Affairs. So thank you so much, Doc Ursos. Do you have any last message, Doc? I will give the certificate.
Yeah, thank you for that certificate, and it's really honored and privilege to be with you this morning and share with your activity. And I would like to commend the university system, the library system. And please continue this. No? And I'm always a call away if you need more help, no? Especially in this advocacy. And lastly, please add MD to my name sa certificate. Thank you.
Yes, Doc. Yes, Doc. So thank you so much, Doc. Now to formally end our eTalk, please help me welcome our head of the Reader Services Librarian, Mrs. Isabel Marino. So is Ma Marino still around?
Yes.
Okay. Hi, Ma.
Once you replace negative thoughts with positive ones, you'll start having positive results. Participants, fellow librarians, faculty, administrators, distinguished guests, ladies and gentlemen, good afternoon. I would like to begin by thanking all of you for joining us this afternoon in our eTalk on managing infodemic, information dissemination in the fight against COVID-19. In behalf of Silliman University Library, I would like to extend our heart. I would like to extend our heartfelt thanks to Dr. Walden Ursos, our resource speaker, for sharing his knowledge and expertise on this subject. He had a very commendable presentation, and certainly each one of us could personally relate, enlighten, and gain knowledge. Let us give our speaker a virtual applause once again. I would also like to thank Ms. Charmaine Loba Galapati as our eTalk facilitator for today. At this point, as individuals, we should know how to identify relevant points of confusion, the spreading of misleading information and harmful narratives, and key questions from public online conversation about COVID-19. and outlines how the approach can be easily adopted rather than only reacting to viral rumors. As we all know, mis and disinformation can be harmful to people's physical and mental health. To conclude today's activity, as what was mentioned by Dr. Ursos a while ago, I would like to end by saying we're not just fighting an epidemic, we're fighting an infodemic by Tedros Adhanom Ghebreyesus. Looking forward for a colorful and knowledgeable day ahead. Thank you and good day.
Okay, so thank you so much, Ma'am Shabel. So may I request everyone, let's take a screenshot for today's eTalk. So kindly open your cameras. Yes.
Wala.
Display the brief.
Wala, di ka nakita.
Hello. Hello, everyone. We would like to see the faces of our participants. And let's take a screenshot. Wow. Okay, so kindly open your camera for our screenshot.
Nandito na ako ba?
Nanigutom. Yung panggutom. Okay, so anyways, we apologize na nalapaw to sa time. So, let's take the screenshot. Okay, nabaanta na? Okay, for the winners sa atong Grammarly Premium account, we have Miss Charabel Samorin and nawala si Miss Cortez. Si Miss Cortez. Okay, so we will take our screenshot now. 1, 2, 3. Okay, so that's okay. So thank you so much once again. Thank you so much. Okay.